So we've seen a number of illnesses through history, like SARS and HIV. What do you think is different about this virus and the way that it behaves?
Well, this is, I mean, as the name suggests, it's a novel coronavirus. I mean, this is part of a family of coronaviruses that have been around in the society for a while, but this is a new entrant to that club. And as such, there's a lot that we don't know about this virus and the disease that it causes, COVID-19. The kind of symptoms that patients exhibit, the impact it has on the different parts of the organs, and the list is growing, and it's quite confusing, actually, to be honest with you. The kinds of symptoms that disease manifests itself in, and different organs such as brain and heart and lungs and toes even, that actually get impacted by that. So that's number one. Number two, it's more infectious than the traditional flu. It's similar infection rate, R naught as it's called, as HIV and the SARS-1, the first SARS. It's less infectious than things like measles, but it's definitely more infectious than the traditional flu. The third thing about this is that it's the fatality rate, the mortality that results from this disease is far more than the flu. The CFR, the case fatality rate, or the IFR, infection fatality rate, number of people who die divided by number of people who are infected. That's very high. Although this IFR right now is under some controversy because of the some of the recent tests about that have said that the rate of population that's been infected is greater than believed. But I think generally it's believed that it kills more people. The fatality rate is greater than traditional flu. And then the other two factors that are really significant about this disease and this particular virus is that the incubation period ranges from a few days to a few weeks. So you don't know how long somebody is, the infection is incubating in somebody, and that person remains infectious during that time. And the last thing, which is probably the scariest of them all, is that you can be infectious even when you're asymptomatic. And up to 80% of the patients that have been infected by this virus are believed to be asymptomatic, although asymptomatic is in quotes because asymptomatic means that patients who are not showing up at the hospitals with and reporting symptoms or are calling in with symptoms. So that doesn't mean that all 80% of them have no symptoms at all. It's just those symptoms are not significant enough that people find them worthy of reporting. So those are the characteristics that make this disease pretty unique and confusing and difficult to deal with. There is a positive element of this disease, if there was one, and that is it's the mutation rate of mutation is lower. So far, we believe that there is only one common strain that this virus has manifested itself as. Although there have been many mutations, but those mutations are fewer than, let's say, traditional flu mutation. So, which means that it might lend itself to a vaccine that may be effective down the road.
Yeah, let's hope that stays the case in terms of mutations.
Mm-hmm.